Rarely does a bill still in Senate committee receive such hype, but now it's out. The health insurance reform bill from Max Baucus's Senate Financial Committee. Having waited for GOP support, the bill didn't actually attract any Republican votes, but it's attracting the lion's share of attention. What does it offer, really? To help us get a grasp, Bernie is back. We welcome back Senator Bernie Sanders, independent from Vermont. Well, let's start with what's in it and what's not. Bernie, there's a lot of talk about affordability. How does this bill, for example, compare to the one that came out of your committee, the HELP committee so-called, earlier this year?
Not as good. No question about it. I think one of the concerns that we have got to address is to make sure that everybody in the middle class ends up with a product that, in fact, is affordable, and that they don't look at their bill and say, my God, I have health insurance, but you know what? Thank you for nothing because I can't afford it. So, in fact, Baucus's committee ends up spending less than what we did in the health committee, and the result of that is that I think the price tag for many middle-class families will be higher than it should, and that is one of the number of issues that we have got to address. The
Health, Education, Labor, and Pensions Committee. Let's talk about mandates. A lot of talk about mandates. Who's mandated to do what under the Baucus proposal?
Well, there are at least two sets of mandates. One is that if you have no health insurance today, you're going to have to get health insurance in a similar way to what exists with automobile insurance in most states in the country. If you are a lower income person, that will be covered. The second mandate deals with employers. There are many employers today who are not providing health insurance to their workers, except for smaller employers, and I don't know exactly the number in the Baucus plan. Employers would either have to provide insurance or kick into a fund that does provide insurance for workers.
What's the free rider provision?
The free rider position is what that says is essentially it's unfair that you have some employers who are getting a free ride. They're not providing insurance to their workers. Their competitors are providing insurance, and the assumption is that's wrong. All of this, Laura, though, the problem with all of this is that because we have not gone forward in a single-payer Medicare for all, what you end up having is an enormously complicated bill. It's a bill that at the end of the day may end up helping many millions of people, but it is complicated. It is much more expensive than it should be because we're not getting to the root cause of why we end up spending so much in the United States, almost double what any other country spends. And the reason is all of the administrative waste within the private insurance companies, because we're not taking on that waste and the private insurance companies and moving to a Medicare for all. You end up trying to maintain employer health care, and if you do that, you have to address those employers who do it. Those who don't, it becomes fairly complicated.
Talk a bit about co-ops. We heard a lot about co-ops over this summer. They are in this bill. What form does this provision take?
I think there's a big question mark attached to the co-op question. I am not a great fan of what I have seen so far. I think they're probably mostly a smokescreen in order to avoid what I think at the very least has to happen, which is a strong public option. Co-ops sound nice, but from what I'm hearing from people who know a whole lot about this, they really will not be effectual in terms of giving people a choice with regard to private insurance or a public option. They will not provide the kind of cost containment that we need right now in legislation. So if you're asking me, one of the weaknesses of the Baucus proposal is who is going to keep the private insurance companies vaguely honest? Who's going to stop them from raising their rates 7, 8, 10% a year, if not a competitive public option? I fear very much that what appears in Senator Baucus's bill does not have the ingredients to do that.
Now, let's talk politics for a second. Senator John D. Rockefeller IV from West Virginia came out and said that he would absolutely, definitively not vote for a bill that did not contain a public option. Has your opinion on that matter changed, Senator Sanders?
Let's talk about politics, and I'm going to answer that question. But before we do, the really important point that we kind of take for granted, but we should focus on a bit, is that in the midst of the disintegration of our healthcare system, with so many people uninsured, underinsured, Laura, with prices projected to double in the next 8 years, healthcare costs doubling, with 18,000 Americans a year dying because they don't have health insurance, they don't get to the doctor on time, with 1 million families going bankrupt this year because of medically related bills. At this point, we have 0 Republicans, not one, who are prepared to support health care reform. And that tells us a whole lot about the extreme right-wing drift of the Republican Party. Not one is, at this point, prepared to be on board. In terms of your question, as I have said a million times, I am an advocate of a single-payer Medicare for all program. I believe absolutely that you need a public option to give people a choice to hold costs down. But I don't want to, on this TV show, have to make any declaration of what I'm going to do. But right now, what I will tell you is I'm going to fight as hard as I can to make sure that we have a public option, and there are a lot of us who feel that way.
Are you going to fight for people to hold their ground on that? This is something that people have actually pledged to do, and yet we're hearing that some are backing back from that pledge.
We have heard that, but I can tell you that there are a number of us who are going to fight as absolutely hard as we can, not only for a strong public option, but in addition to that, to begin to focus on disease prevention. We have a disastrous situation in this country in terms of primary health care, quality control issues. Some facilities charging a whole lot. Their outcomes are poor. Others are charging relatively little. Their outcomes are better. Why is that? So there's an enormous amount of work. Quickly, 15
seconds, Senator, what can people do at this moment?
I think they should raise their voices as loud as they can. Let every member of the United States Senate know that we need a strong, real health care reform, which must include, among other things, a public option.
Where are the demonstrations?
Do that, too.
Senator Bernie Sanders. For more from the senator, don't forget to check out his commentaries each week here on GRITtv, courtesy of Brave New Film.